Fungal nail infections begin as white or yellow nail discoloration and eventually leads to thickening of the nail. And if it goes untreated, you may lose the nail altogether. Since it's highly contagious, you can pass it easily on to other family members. Laser heats the nail and the surrounding area to destroy fungus. Clinical trials have shown an 85% success rate. Up to 5 laser treatments are required, spaced out 4 to 6 weeks apart. Susceptible individuals are those with lowered immunity due to illness such as diabetes, liver or kidney disorders, as well as anyone with excessively sweaty feet. It's important to avoid all the causes of fungal nails and to sterilise your shoes to prevent reinfection. Toenails take about a year to grow out. This photo shows a healthy nail beginning to grow out 5 months after laser treatment. Fingernails only take 6 months to grow out. Laser is a safer alternative to oral medication for fungal nail infections and is available at my skin clinic.